It starts with a small cough and ends with a fight for air. Let's talk about asthma. Asthma is a condition that causes long-term inflammation in your airways. The inflammation makes them react to certain triggers, like pollen, exercise, or cold air. During these attacks, your airways narrow, swell up, and fill with mucus. This makes it hard to breathe or causes you to cough or wheeze. Without treatment, these flare-ups can be fatal. Millions of people in the US and around the world have asthma. It can start in childhood or develop when you are an adult. It's sometimes called bronchial asthma. Experts aren't sure what causes asthma, but you might be at a higher risk if you live with allergies or eczema, were exposed to toxins, fumes, or second-hand or third-hand smoke, especially early in life, have a biological parent with allergies or asthma, experienced repeated respiratory infections as a child. About complications of asthma, we can say asthma can cause severe flare-ups that don't get better with treatment. This can be fatal if you can't get enough oxygen to your organs and tissues. Symptoms of asthma include shortness of breath, difficulties of breathing, dry cough, night cough, wheezing, chest tightness, pain, or pressure. You might have asthma most of the time, or you might feel fine in between asthma attacks. Asthma triggers or anything that causes asthma symptoms or makes them worse. You might have one specific trigger or many. Allergies like pollen, dust mites, pet dander, or other airborne allergens. Cold air, especially in winter. Exercise, especially intense physical activity and cold weather sports. Mold, even if you're not allergic. Occupational exposures like sawdust, flour, glues, latex, and building materials. Respiratory infections like colds, flu, and other respiratory illnesses. Smoke like second-hand smoke and third-hand smoke. Stress, physical or emotional. Strong chemicals or smells like perfumes, nail polish, household cleaners, and air fresheners. Toxins in the air, factory emissions, car exhaust, or wildfire smoke. Asthma triggers can bring on an attack right away, or it might take hours or days for an attack to start after your exposure to a trigger. An allergist or pulmonologist diagnoses asthma by asking about your symptoms and performing lung function tests. They'll ask about your personal and family medical history. It can be helpful to let them know what makes asthma symptoms worse and if anything helps you feel better. Your provider might determine how well your lungs are working and rule out other conditions with allergy blood tests or a skin test, blood count, a spirometry, chest x-ray or CT scan. The best way to manage asthma is to avoid any known triggers and use medications to keep your airways open. Thank you for being with us until the end of this video. We hope that you learn enough about asthma and how it can be triggered by this video. On the other hand, we tried to inform you about symptoms of it, so don't forget not to ignore it. If you are interested to medical world, don't forget to subscribe our YouTube channel too.